in of meeting on the topic artificial intelligence in dentistry. It's indeed a great pleasure for me to speak in front of the faculty. I mean, as a student, I used to say, faculty used to stand here. Now I'm standing here, just give me a major panic attack and adrenaline rush. Anyway, let's dive into the topic. So artificial intelligence. As we all know, we all gathered here. We are using Android iPhones, Android gadgets. So starting from face recognition and lock to giving voice commands by Siri, Alexa, the artificial intelligence have revolutionized the mankind. So let's evaluate how the artificial intelligence could change the dentistry and its impact, its shortcomings, and the future changes in the dentistry. So what is basically artificial intelligence? Artificial intelligence is it's perceiving, synthesizing, and inferring the information demonstrated by machines as opposed to intelligence displayed by animals and humans, which means the intelligence the human brain possesses will be transferred to a machine, by which the machine will be performing the same way how a human brain could do. So I'll dive into a small history regarding the artificial intelligence. So the artificial intelligence was founded as an academic discipline in 1956, and in years since it has experienced several waves of optimism followed by disappointment and the loss of funding, which is known as the AI winter phase, followed by the new approaches, success, and renewed funding. In the first decades of 21st century, highly mathematical, statistical, machine learning has dominated the field, and this technique has proved highly successful, helping to solve many challenging problems throughout the industry and academics. So there was two phases. The artificial intelligence, something which is equal in during the 20th century, where there was a shortcoming, limitation in the funding, in which there was limited amount of research. But at the present, in the Western countries, there was high amount of funding is provided for the artificial intelligence, which means a rapid revolution is taking place. Now, what are the components of artificial intelligence? So there are 5 components of artificial intelligence. Like, there are 2 types of artificial intelligence. We have strong artificial intelligence and weak artificial intelligence. So strong artificial intelligence is something which is working in the same manner as a human intelligence, which is based through non-artificial hardware and software reconstruction, whereas we have weak artificial intelligence. It's simply a problem-solving mechanism, which means it's a system that develops the problem-solving ability by itself through learning, using some of the sense and thinking mechanism of the people. Strong artificial intelligence is something which is going to be used in the dentistry field, whereas weak AI is used in your Siri, Alexa, face recognition in the iPhones, etc. Now the 5 important components of the artificial intelligence are, we've got the machine learning, deep learning, representation learning, artificial neural networks, clinical decision support system, augmented reality, and virtual reality. This comprises the different concepts of artificial intelligence. So the machine learning is a branch of computer science that build algorithms guided by data, which means the software engineers will be creating algorithms. Correspondingly, the softwares will be developed accordingly. Then we've got the deep learning. Deep learning is a specific form of learning based on algorithm of the neural networks. Then we have representational learning. The representational learning is a subtype of the machine learning, in which the computer algorithm learns the features required to classify the provided data. This does not require a hand-labeled data like a machine learning. Then we have artificial neural network. The artificial neural network is something which has dramatically revolutionized the field of dentistry. So practically this is involving a network of highly interconnected computer processes that has ability to learn from the past examples, analyze nonlinear data, handle imprecise information, and generalize, enabling application to the model of independent data, thus making it a very attractive analytical tool in the field of medicine. For example, how AML is revolutionizing the dentistry. We'll be uploading a lot of images regarding the different pathologies. So the computer program will be recognizing the pathology, by which from any of the patient try to upload their image, the processor will be analyzing from the past stored image, by which the correct diagnosis can be made. I'll come to that. So this is something the principle of artificial neural network. So artificial neural network has significantly changed the field of medicine. Then we have got clinical decision support system. The clinical decision support system is a system between the broad dynamic medical knowledge database and inferencing output mechanism that are a set of algorithms derived from the evidence-based medical practice executed through medical logic modules. And we have something which is very popular, like augmented reality and the virtual reality. So augmented reality is defined as a technology that superimposes computer-generated image on a user's perspective of the real world, accordingly giving a composite view. The virtual reality is a computer-generated reenactment of a three-dimensional image or environment that can communicate it with an apparently real or physical path by an individual utilizing the unique electronic equipment. So, I'm coming to the major topic, the topic of interest, which is how artificial intelligence in dentistry, what is the past and what is the present and how. This is going to be a comprehensive review of various articles which are being published regarding like the different fields, how AI has been impacted in different fields. So in a brief introduction, artificial intelligence has remarkably increased the presence and significance in a wide range of sectors, including dentistry. It can mimic the intelligence of human to undertake complex prediction and the decision making in the healthcare sector, particularly in endodontics, radiographic diagnosis, implant prosthetics, etc. So how does an artificial intelligence model work? So artificial intelligence model works the working mechanism takes place in the two phases, which is the training phase and we've got a testing phase. In the training phase, so the parameters of the model set are determined by the training data. Retrospectively, the model makes use of the data from the prior examples such as patient data or data from the datasets containing the various examples. So this is a small diagrammatic representation. The first thing, the 2A represents a cat. So black box corresponds to the deep neural network, which is the various programs, softwares and algorithms related to the artificial intelligence. It is basically registered to be as cat. And subsequently, when similar images are being sent to the artificial intelligence system, based on the characteristic identical feature of the image, the neural network, the artificial intelligence will be recognizing this as a cat. So this is basically the mechanism taking place in an artificial intelligence system. So artificial intelligence models may consider as black box, as I previously mentioned, because earlier they provided an output without any explanation of why and how they arrived at it. So this is simply, so in case of a patient scenario, we'll be providing input in the form of radiographic images, the images of the patient, the lesions of the patient, the photographs, other any spectral images. Besides, we'll be also providing like treatment record, experimental parameters, the text data, electronic data. These are basically provided to the AI, which means the black box, which I previously mentioned. So based on the already pre-registered computer programs, algorithms, it will be deciding the treatment plan, ultimately the diagnosis and the output, which means the treatment prediction, the prognosis, the genetic analysis in case of periodontal disease, everything will be basically identified by the artificial intelligence. Now I will be analyzing how artificial intelligence is indeed changing every field of the dentistry. So in general, so artificial intelligence software can be used for fixing and coordinating appointments according to the convenience of the patient and practitioner, altering the dental healthcare provider about any relevant medical history that the patient may have before every appointment, notifying the patients and dentists about checkups whenever any genetic and lifestyle information indicates increased susceptibility to the dental disease, like periodontal screening after patients with diabetes and oral cancer screening for those who have any use of tobacco, managing documentation work and insurance, assisting in the clinical diagnosis and treatment planning, setting up regular reminders for the patient who are on tobacco or smoking cessation program, providing emergency tele-assistance in case of dental emergencies when the dental healthcare professional cannot be contacted. Artificial intelligence software enables us to create a complete virtual database for every patient, which can be extremely detailed and accessible at the same time. Now we'll be evaluating how each discipline of the dentistry is being serviced by the artificial intelligence. Maybe brief, I'll be starting with endodontics as it's the bread and butter of dentistry. So in case of endodontics, ranging from the diagnosis of the dental caries and identifying the periapical lesion, identifying the root fractures, the root canal morphology and system, the stem cell viability for the determination of working length, root caries, the difficulty level of the case assessment, and also chance of retreatment and even locating minor apical foramen. The artificial intelligence has impacted the field of endodontics. So this is simply an artificial intelligence based diagnosis which is basically used in Harvard School of Dental Medicine. So the first image is standing for the expert diagnosis, something which is diagnosed by an endodontist. The second one is basically the intraoral scanners by an artificial intelligence system. So we can relate the amount of accuracy. The first image stands for a cavitated caries on a crucial surface. The artificial intelligence scanner has detected 96.8% of the cavitated caries, which means the accuracy is very high in terms of an artificial intelligence system. The other case, there is no caries which is detected by an endodontist. The other artificial intelligence has diagnosed to be 100% no caries, which means the accuracy of using artificial intelligence in the field of diagnosis is very high. This is a scanner-based system which is used in Harvard School. Now I'll be evaluating the various research articles regarding the artificial intelligence in the field of endodontics. So this is basically critical review of the various published articles. So as we all know, in case of endodontics, the majority of the cases approaching to endodontic cleaning would be periapical lesions, which is like periapical abscess, apical periodontitis. So currently we rely on the two-dimensional radiograph, that is IOP and OPG are the two important radiographs which are most frequently used in the endodontist for the diagnosis of the periapical lesions. And moreover, nowadays we have a three-dimensional methods like CBCT is also being currently used in the field of endodontics. However, a meta-analysis, which means an analysis was conducted between the accuracy between the use of two-dimensional, three-dimensional system in the identification of root canal periapical lesions and artificial intelligence. So based on a series of meta-analysis, the accuracy score for CBCT was 0.96. The IOPA was CBCT imaging was 0.96, IOPA, which is a two-dimensional, was 0.73, and digital light distance for radiovisuography is 0.72 respectively. So the characteristics of periapical radiolucency and the alveolar bone resorption can both aid in the creation of artificial intelligence model for the detection of periapical pathology and the apical periodontitis. So according to Endres et al., his research work based on his deep learning algorithm software he have developed based on the identification of the periapical changes in the radiograph. So it was basically identified that an artificial intelligence system can detect periapical radiolucency as accurately as a 24 maxillofacial surgeons. So there is another research study by Owen et al. Out of 142 out of 153 periapical lesions have been accurately able to be diagnosed by artificial intelligence system, which means the accuracy rate is high as 92.8%. Next is the determination of working length. In clinical practice, we rely on the radiographic method and also we have the electronics apex locator. According to Grossman, the both electronic apex locator and the radiograph stands equal in the importance of working length determination. However, radiographically, since it is a two-dimensional projection, errors do happen in determination of the working length. So it's a series of research work done by Sagiri et al. So according to him, the accuracy of the working length assessment can be improved by employing artificial neural networks as a second opinion to locate the radiographic apical foramen. In a different research, the Sagiri et al. Used a model of human cadaver to replicate a clinical setting and examine the accuracy of working length assessment by artificial neural network. See, all these topics of research is ongoing. This is not actually totally published, which means more and more researches are taking place in the field of application of AI in the field of endodontics. So when comparing the artificial neural network, the real measurement after extraction, they discovered no change in the root length measurements. Additionally, they noted that when utilizing periapical radiograph to determine the minor anatomic construction, that is AM, the artificial neural network has an accuracy of 96%, which is outperforming in endodontics, which is having an accuracy of 76%, which is actually a wide margin. So as a result, AM may be thought of as an accurate approach for determining the working length. Next is basically the morphology of root canal system and the root canal morphology. Ultimately, the success of every endodontic treatment relies on the fact how well we identify the canal, how well we obturate the system. So especially in very complex anatomic cases like radix entomodalis, where we cannot simply rely on a two-dimensional radiograph. Currently we shift to a CBCT based, 3D based assessment, pre-diagnostic assessment of the case. So artificial intelligence system was also performed for identifying root canal morphology. So according to Hiragi et al., the distal roots of the mandibular first molar, which is radix entomodalis, could be differentiated from one another using deep learning algorithm that use panoramic radiographs. And another study by Lahore showed automated three-dimensional teeth segmentation using the CNN approach. In a rapid, accurate and effective clinical reference evaluation of 433 cone beam computed tomographic segmentation of teeth, the authors were found that artificial intelligence performed exactly as well as a human operator while working in the same scenarios. Now coming to the maxillofacial radiology. So as I mentioned, in endodontics we have different, which means ranging from the diagnosis to ultimately determining the prognosis and also predicting the retreatment cases. The artificial intelligence can be used in. And coming to the second discipline, which is maxillofacial radiology. So the diagnosis and treatment of the lesions of oral cavity can be screened and classified into suspicious altered mucosa undergoing pre-malignant and malignant changes with the help of artificial intelligence. Machine learning algorithms can detect an abnormal or normal lymph node in the head and neck image provided by a trained radiologist who can interpret by analyzing thousands of such images which are labeled as normal and abnormal. So this is basically an artificial intelligence based system in orthophantomography. So basically we have a bridge, we have an implant. So artificial system has identified all these different matches within this radiograph with an accuracy like more than 60%. Next is in the case of maxillofacial pathology. In the field of pathology, AI as artificial intelligence can be used to scan large number of tissue sections following histochemical and histological process to locate minor details which will be aiding in the diagnosis and clinical decision making. AI can be accurately used to predict the genetic predisposition to oral cancer in a large population. Next, in pediatric dentistry, we have pharmacological and non-pharmacological means of behavior management in pediatric dentistry, but the research has been basically proved artificial intelligence can be also used in case of the behavior management of the pediatric, non-cooperative pediatric patients. So artificial intelligence enabled pain control gadgets is a new, smarter way toward injection-free periodontic practice. The various 4-dimensional goggles, movies, animations and virtual reality-based games can be used as a behavior modification of the pediatric patients. Next, in the field of periodontics, the deep learning analysis using the radiograph can help in diagnosing and treatment planning of periodontal disease by early detection of the periodontal bone changes in the bone density, which will be also helping in the diagnosis of the peri-implant. This also basically plays a very role in the intervention of implantology phases of treatment. An artificial neural network can be also effectively used for classifying patients into aggressive periodontitis and chronic periodontitis based on the immune response profile. As we all know, aggressive periodontitis has a strong immune response, moreover a genetic predisposition. So using the artificial intelligence system, we can categorize a patient into something who belongs to chronic periodontitis and an aggressive periodontitis. In the field of oral and maxillofacial surgery, so we have some, as I mentioned earlier, we have augmented reality and virtual reality. This augmented reality and virtual reality could be used in the field of surgery. So basically, image-guided surgery mechanism. So image-guided surgery in the cranial area for basically for the removal of tumor, resection, foreign body biopsy, TM surgeries, and also oral implant surgery. Also, the image guidance allow more thorough surgical resection, potentially decreasing the need of revision procedure. A study on head and neck cancer attempt to use convolutional neural networks for performing segmentation of organ at the risk of head and neck cancer in CT images. Another study was performed which demonstrated that genetic programming performed the best in the oral cancer prognosis when the features selected are tobacco smoking, alcohol drinking, tobacco chewing, histological differentiation of the squamous cell carcinoma, and the oncogene. The artificial neural networks may be of great importance for the identification of grading of a patient with a high risk of oral cancer or pre-cancer and further to plan the treatment regimen. So this is basically an image-guided surgery. So this is precisely identify the inferior alveolar nerve, the corresponding surgical field, the surgical anatomy of the mandible. So this is an example of the image-guided surgery which was previously mentioned. This is also seen an image-guided surgery base in which they has precisely identified the inferior alveolar nerve, the location, the precise position of the wisdom tooth, the corresponding root, its location, its proximity to the nerve. So the image guiding surgery principle can be applied to the field of for the success of oral and maxillofacial surgeries. Next is orthodontics. So I guess artificial intelligence is something which is currently revolutionizing. It's ongoing in the field of orthodontics. So in case of orthodontics, the diagnosis and treatment planning can be done by analysis of the radiographs and photographs taken by intraoral scanners and cameras. So this will be eliminating the necessity of making facial impression as well as several laboratory steps, and the results are usually much more accurate compared to the human perception. The tooth movement and the final treatment outcome can be also predicted by the algorithms and statistical analysis. So the most talked about revolution in the orthodontic dentistry by means of the artificial intelligence is customized orthodontic treatment. Artificial intelligence is now used in various phases of orthodontics, starting from diagnosis to treatment planning and follow-up monitoring. Three-dimensional scans and virtual models are useful in assessing the craniofacial and dental abnormalities. So with the help of these 3D scans, by which the artificial intelligence uses the 3D scan, aligners can be printed and the treatment can be customized. After these printed aligners, a data algorithm is created that intelligently decides how the teeth or the tooth of the patient should be moved, how much pressure should be applied, and even also recognize the pressure points for the specific tooth or teeth. The AI conjugated aligners not only provide precise treatment but also reduces the chance of error and also the time for treatment. So this is basically an intraoral scanning based orthodontic treatment planning. So they have scanned the entire oral structures and they are also performing model analysis based on the computer based algorithm which will be reducing the clinical time. The clinical steps including the impression taking, the task scoring can be significantly reduced, the time can be reduced for the treatment planning by using artificial neural networks. This is also simple. For example, a patient comes with a malocclusion, we will be registering the data, we will be recording the photographs with the artificial intelligence system. So artificial intelligence has also always been pre-registered with different cases, different patients' data, which means the system will be analyzing and ultimately the bone assessment, the skeletal malocclusion, the dental malocclusion, the need for orthodontic surgery, the changes before and after treatment can be predicted and designed using the artificial intelligence software system. Now coming to the prosthetic dentistry, in order to provide real, ideal aesthetic processes for patients, various factors like anthropological calculations, facial measurements, ethnicity, and patient preference have been integrated by design assistant, which is called as RAPID for the use in the prosthodontics. So RAPID is something which is it's a software which is based on the artificial intelligence based software which is commonly used in the field of prosthodontics. So RAPID integrates the computer-aided design, knowledge-based systems and database employed by a logic-based representation of unifying media. Now, the same CAD/CAM design printing, the CAD/CAM milling of the ceramics, so is something which is commonly ongoing in the field of prosthodontics. So, computer-aided design, computer-aided manufacturing, application in dentistry is a process by which is attained with finished dental restoration through fine milling process of ready ceramic blocks. Is used in the manufacture of inlays, onlays, crowns, as well as bridges. So, computer-aided design manufacturing technique essentially creates two-dimensional and three-dimensional model and the materialization by numerically controlled mechanics. It has replaced time-consuming and laborious process of conventional casting and reducing the human error component of final processing. So this is simply an example of intraoral scanning of a patient's arch and correspondingly prepared to, and these informations by means of artificial intelligence, it will be sent to the milling machine, and from which the milling machine will be milling the ceramic block, the corresponding prosthesis will be milled. So similar previous image, a prepared to, which is basically scanned by an AI scanner, an artificial intelligence based scanner. Will be also detecting the various pressure points and all on the prepared tooth surface. Now in the forensic odontology, artificial intelligence is a scientific development and has been extensively applied in the forensic medicine. It has shown to be quite effective in determining the biological age of gender, determination of the healthy and ill. Additionally, it is employed for analyzing bite marks and also predicting the mandibular morphology. Now, artificial intelligence can be also used for the field of dental education. How artificial intelligence can help students, dental school students, to generate scenarios that imitate clinical work on the patient and minimize all the hazards involved in the training on a live patient. Artificial intelligence is frequently employed in the field of dental education. As a result, the preclinical virtual patient feedback to the students has been significantly improved. By allowing students to access their work and compare it to the ideal, the interactive interface creates high quality learning settings. The numerous studies on the effectiveness of the system have been shown. Students develop a competency-based skill level more quickly with the system than with the conventional dental simulator units, which we have in our college system. So this is an example of a dental simulator, which is saying in the Harvard School of Dental Medicine. It will be providing a three-dimensional complete view of the oral cavity, by which any preclinical exercises for the local anesthesia injection techniques, or even cavity preparation, identifying the anatomical landmarks of the mouth. These three-dimensional dental simulators can be used. So this is also a design, artificial intelligence-based three-dimensional dental simulator system. So the previous image was belonging to this. So there has also correspondingly, there has a computer-based program software, and they also has necessary tools for studying various activities which we are going to be performing in the patient. This can be studied. It should be ultimately improving the skill, moreover the accuracy performing before patient. Now the dental chair and artificial intelligence. So dental chair, as we all know, is a crucial component of everyday dentistry practice. So currently we use a dental chair which is based works on the principle of physiology, hydraulic and pressure chairs with a manual pump to become electric attached multiple sensor. The most recent innovation is the voice command dental chair. It does not require the doctor to physically do anything. Voice commands are used for all operations. Soon dental chair will be able to monitor the patient vital signs, anxiety level, weight, and the length of the process, will also comforting the patient, warning the operator doctors if any variations are found, and so on. This is because the intelligent minds are working tirelessly on the artificial intelligence. Like the way how we provide voice commands to the Siri, Alexa, the same thing we can provide a voice command, which means it will be performing tasks. This would be the future of the dental chairs. Now I'll be evaluating the artificial intelligence, a success story in India. So this basically is a couple. She is a software engineer and she's a dentist. They are basically Pune-based dentists. So she has developed, she has a dental block which is basically called as dental dose. They has turned a dental block platform to an artificial intelligence based program for the diagnosis of the patient. So I'll be sharing their success story. So this is a tech platform for the oral hygiene by Dr. Vidhi and her husband Rajat decided to expand their block dental dose into artificial intelligence powered dentists by leveraging artificial intelligence and machine learning. They also launched a 24/7 helpline to better understand their patient problems in order to diagnose oral disease. So according to her words, when a patient comes to the dental dose platform, we offer free teleconsultation or consultation through the app. A treatment profile is created for the patient and we refer him to the nearest partner clinic for the treatment. Now how does this application basically works? We started exploring the various ways of implementing artificial intelligence and machine learning to help patients diagnose oral disease. The first step was to create a data set of intraoral images. They invested a year working with medical universities and dental clinics across India and collected across a data set of 30,000 images. A 24/7 helpline is basically formed. Skilled dentists, which are on full-day payroll of the dental doors. These dentists are trained in tele-dentistry and can understand and explain the oral issues on a phone call. So patients are asked to upload their intraoral images of the app, where the machine learning technology pre-assess and the dentists verify the machine learning analyzed results. Post this, the dental dose team gets in touch with the patient and help them to understand the various treatment options in case the patient does not need clinical treatment. They provide with them with home remedies and tell how to prevent future issues. So they have collected a series of different images from different spectrum of clinics across India, and so whenever a patient uploads a corresponding lesion or a corresponding disease in the app, the artificial intelligence based system will be identified and will be recognized from the pre-registered images, the pre-registered information, by which the accurate diagnosis and the time of the patient can be reduced. So this is a dental dose, which is basically one of the successful artificial intelligence based launch. It's a launcher which has been successfully going on in India. This is dental dose, which is from a Pune based doctor. Now, what is the impact of artificial intelligence on dentistry? So, although there is a plenty of talk about how artificial intelligence can change dentistry, questions remain about whether it will ever completely replace a dentist. So, I would like to remember the famous movie by Charlie Chaplin, where machines were completely replaced by the humans in the pre-World War era. So, the dentistry performed by machines and without human interaction does not represent clinical care. Machines cannot provide clinical intuition, intangible perception, or empathy, which are essential for providing individualized healthcare and professionalism. The most fascinating aspect of human-to-human communication cannot be easily translated into the computer language. Now, what are the shortcomings of artificial intelligence in dentistry? Definitely, this is going to be a very expensive, costly sector. Moreover, there is a mechanism system complexity because ultimately the entire process of AI is working on the basis of computer softwares, algorithms, programming, and all. Definitely, an intensive and adequate training is required for the same. Data is often used for training and testing, leading to data snooping bias, which is something very important. Significant shortcoming of the artificial intelligence and the outcomes of artificial intelligence in dentistry is something which is not readily applicable to the present scenario, which means more and more research and funding should be required for the same to the revolutionary field of dentistry. So I'll be concluding my talk. So in the field of dentistry, it's filled with a lot of knowledge, technology, and art. The combination of dentistry and the artificial intelligence has grown tremendously in the last decade. These systems play a very crucial role in dentistry as a way to obtain immediate diagnosis and treatment plan for complex problems or disease. These AI systems have been promising a magnificent upcoming future both in general dentistry and also radiological diagnosis. However, AI never will be able to fully replace the human dentist, but it will help dental professionals to perform at a higher and comfortable level by making their profession much easier without any kind of human error. The future of dentistry along with artificial intelligence is very bright. The technology should be tried and to be accepted by every generation's dental surgeon. Thank you.